If you are in your 40s and 50s, you've probably heard a lot about hormones, whether it's hormone replacement or natural alternatives. I get the question all the time, should I be taking hormones? Is it time to take hormones? So, how do you know if it's the right time for you? Today, we're going to dive into that question and what you need to consider before making this decision for yourself. We're going to go over what hormones are involved, when hormone therapy may be needed, the pros and cons of hormone therapy, and alternatives to hormone therapy as well. A quick rundown of the hormones involved in this menopausal transition. Estrogen plays a role in your mood, your cycle, how your skin changes, and the health of your bones. Progesterone, it balances your estrogen, supports sleep and uterine health. Testosterone affects your energy, libido, muscle mass, and mood. Thyroid hormones impact your metabolism, energy levels, and weight. Cortisol is a stress hormone and can impact everything from fat storage to mood. They all work together, they all have a role depending where you are in your menopausal transition. Some hormones may be affecting you more than others. So, what is HRT, hormone replacement therapy? It honestly can look very different for different people, but comes in a lot of shapes and sizes. It could be estrogen only, combined estrogen and progesterone, testosterone therapy, synthetic, or it could be bioidentical hormone therapy. It also comes in the form of pills, patches, creams, gels, and injections, as well as hormonal pellet therapy. When is it recommended? Symptom relief is the big reason people take hormones. For severe menopause symptoms like hot flashes, night sweats, and mood swings. Bone health and keeping your bone density strong is another reason. And lastly, and a really important one, is premature menopause. So when you go through menopause prior to your mid 40s, especially in your 30s, you're going to have a lot of life ahead of you without these hormones. Replacing those hormones early on is going to be helpful to protect your long term health. The downside of hormone therapy is pretty small. For the person who needs the medication, they should, in conjunction with their provider, decide if it's right for them and really should be offered it as an option. The cons are worry is about increased risks of certain conditions such as blood clots, strokes, cancers, heart disease, especially in women with a history of these conditions. This is a relevant conversation. For a healthy, low risk woman who is early in her menopause transition, however, the risks of these things are very low. So each woman has to understand those individual risks based on her family history and personal history, and then decide if her symptoms warrant treatment. It has many pros in terms of quality of life, relief from symptoms, and bone protection. For women earlier in the transition, it may have some positive effects on cardiovascular health. That being said, it's not cardioprotective for all women. So now you may be thinking, okay, Lisa, thank you for the rundown, but I don't know if I really want to do this. I might have symptoms, but they're not so bad. What else could I do instead? And the truth is, you could do quite a bit. Lifestyle changes make a big impact. Your diet, focusing on a balanced diet with plenty of phytoestrogens or components in our diet that act on some of our estrogen receptors, healthy fats, and calcium for your bone health, exercise, regular physical exercise, as well as strength training for your muscle retention and your bone protection, and sleep hygiene. Sleep makes everything better. I say this. Your sleep hygiene is critical. Addressing sleep disturbances, doing what you can to get regular sleep patterns, reducing your screen time before bed, keeping your bedroom cool, all the extra things to help you sleep well at night. There are some non hormonal supplements on the market. They all have a similar impact and influence. They're going to be less impactful, however, than actually taking the hormone therapy. And those would be things like black cohosh and red clover. Additionally, magnesium for sleep, relaxation, vitamin D and calcium for your bone health and strength. We also have other medication, non hormonal prescriptions, such as a low dose antidepressant, as well as alternate preparations of hormonal therapies, things like vaginal treatments or DHEA, which is a precursor to other hormones that can address really specific concerns like vaginal dryness, discomfort, without systemic therapy going through your whole body. So, how do you make your decision? You talk to your provider, you consider the key factors such as how interruptive are your symptoms, what is your health history, are you at a personally increased risk because of your current medical condition? Do you smoke? Do you have cardiovascular risk factors? What's your 10-year projection for cardiovascular disease? These things can help your provider give you factual context for whether or not you are a candidate for hormone therapy. But at the end of the day, the question is, do you need it? Do you feel like you need it? How are you getting through your days? How is this change affecting your quality of life? Talk with your medical provider and make sure that provider listens and is knowledgeable. You can search the Menopause Society website for a lot of great candidates who are really interested in being an expert in the field of menopause care. Uh, Ongoing monitoring is warranted for everyone on hormonal therapy. Regular check ins with your provider ensure it continues to be safe for you to take this medication. When symptoms begin, you should consider treatment. It should always be an individual decision between you and your provider. There's no one size fits all answer. Women have options and should determine whether it makes sense for their life, their health to take these medications and which preparation of those medications is both the safest, the most helpful, and targeted for their concerns.